Why do the patients with a gastric sleeve lose a lot of weight? That's a common question, and some of the answers are really straightforward because we're reducing the size of the stomach. If we decrease the size of the stomach, patients will be able to eat less, and that will lead to a weight loss. But that is not the only reason. When we do a gastric sleeve, we're making the sleeve into a small, a thin tube, long tube. That will decrease the size of the portions of meal the patients can eat. But we are also removing a part of the stomach. In that part of the stomach that we're removing at the operation, there is a production of a lot of hormones and substances that regulate appetite. So it is not only a decrease in the appetite, it is also a lot of hormonal changes that decrease the appetite, the hunger sensation of the patient, increase satiety. Patients will eat less because they have less desire to eat. They have less appetite, and that will help patients lose more weight. It's not only decreasing the size of the portion. If it were that way, patients could get to the same weight loss just simply by reducing themselves the portion of food. But it doesn't work that way. Removing that part of the stomach will produce hormone changes that will make the patient lose weight easier by decreasing appetite, by decreasing the hunger sensation, and by increasing satiety. Many patients refer that they are very anxious when they're going to eat, and they refer anxiety when they're eating. After the gastric sleeve, very often, many of those patients say that they are very relaxed when they're going to eat. They don't feel anxiety, they feel relaxed. And that's because of those hormonal changes that decrease the appetite and increase the satiety sensation. So, why do patients lose weight with a gastric sleeve? There are several reasons. One, and very obvious reason, is the decrease in the size of the portion that patients can eat. But there is also other side of the story, and there are many changes, hormonal changes that happen in the patient that can explain many of the sensations that the patient has in the decrease of appetite and the increase of satiety. So it's there are multiple reasons to explain the weight loss in the patient with gastric sleeve. The gastric sleeve is today the operation that is performed more often in the United States and in many countries in the world for the management of obesity. The weight loss is excellent and the quality of life of the patient is very good. The reason of this weight loss is the decrease in the size of the portion and a lot of hormonal changes that take place after removing that part of the stomach. Thank you.